Hello, dear friends. I am Dr. Mohammed Shafee, professor in the Department of Community Medicine, working at JIIU's Indian Institute of Medical Science and Research, Badnapur. This is another video in the series of effects of Ramadan fasting and on human body. So in this video, we are going to see about the effects of Ramadan fasting on blood glucose levels and also the effect on diabetes mellitus. So let us start this video. So first we will see about the effects of Ramadan fasting on blood glucose levels in normal individuals, not in diabetic patients. So during Ramadan, we Muslims, they have a different lifestyle, including diet and physical activity pattern, which is affected particularly, and it has the influence over the plasma fasting glucose levels or blood glucose levels. So blood glucose level is reduced in healthy young adults after a couple of weeks of starting fasting. So there is an effect over the blood glucose levels. Ramadan fasting improves blood glucose level in obese as well as overweight adults also. The reduction of blood glucose in healthy individuals are within normal range with no significant adverse effect. Ramadan fasting also known to increase insulin sensitivity and decrease insulin resistance. So when the insulin becomes sensitive, the blood glucose levels are reduced. As the insulin increases the utilization of blood glucose in the body. So what are the mechanisms by which the Ramadan fasting reduces the blood glucose levels in healthy individuals? Because during fasting, there is no calorie intake. At the same time, there is continuous use of glucose in the body for various vital functions. So glucose is consumed and there is no intake during fasting. This leads to lowering of blood glucose levels. The depletion of glycogen, which is stored in our liver, in the glucose is stored in the liver in the form of glycogen stores. So during fasting period, this glycogen is depleted after the prolonged fasting. So there is an decrease in the blood glucose level. This is due to reduction in insulin concentration and the increase in glucagon and sympathetic activity. So these are the mechanisms by which the blood glucose level reduces in a healthy normal individual. The other mechanisms are that these lifestyle changes in the form of physical activity, dietary habits, sleep patterns, they affect the various other hormones like thyroid hormones, pituitary hormones, and thyroid hormones. So all these changes, they decrease in the glucose levels. So this is another mechanism of fasting which leads to reduction in the blood glucose levels. Now coming to the diabetes and Ramadan or Ramadan fasting and diabetes. So diabetic patients can fast during the month of Ramadan. So please listen this carefully. The diabetic patient can fast, but after the consultation of their primary physician for proper glycemic control. So what do you mean by glycemic control? The blood sugar level control with the adjustments in the medication. So Ramadan fasting may be beneficial for their health who are suffering from diabetes. So better outcomes may be achieved if adjustments in timing and dosage of medication is done. So please remember, before you go for fasting, you should decide about the timing and dosage of the anti-diabetic medications along with the appropriate dietary and lifestyle changes. People who receive adjustments to anti-diabetic drug doses during Ramadan achieved better glucose control. So if people are doing adjustment for their medication with the consultation of physician, their blood glucose level is better controlled as compared to those diabetic patients who don't do any adjustment. So in both male and female patients of controlled type 2 diabetes mellitus, there is significant decrease in blood glucose level, hemoglobin A1C, total cholesterol, low density lipoprotein cholesterol, triglycerides, uric acid, systolic and diastolic blood pressure during the Ramadan as compared with before Ramadan. So these are all the overall effects of fasting on our body in type 2 diabetic patients. So after Ramadan, patients with diabetes have small and temporary loss in body weight and decreased waist circumference. So it happens with everybody also. The improvement in hemoglobin A1C was more notable in patients whose medications were adjusted in an attempt to mimic the physiological secretion of insulin throughout the fasting period. These patients also have low incidence of hypoglycemia. Now coming to the microalbuminuria, so this is one of the indication of the diabetic nephropathy, particularly when the kidney is affected in diabetes. So microalbuminuria is the presence of albumin in the urine. So microalbuminuria is an early sign of diabetic nephropathy and other diabetic complications. So microalbuminuria is also characterized by increased prevalence of arterial hypertension, proliferative retinopathy, and peripheral neuropathy. So these conditions are indicated by presence of albumin in urine. So there is a significant decrease in the albumin in the urine during Ramadan. Now planning for Ramadan fasting for diabetic patients. So first you need to do the changes in medication with the consultation of your physician. You should not do it by yourself. Frequent monitoring of blood glucose level to see whether there is a glycemic control or not. Then planning the meals and some kind of exercise should also be done. Then recognizing the risk of hypoglycemic attack, and you should know when to break the fast. So if you are going into the hypoglycemic attack, it is better to break the fast and take some food or glucose. So all patients should be educated about the symptoms of hypoglycemia because this is one of the most common complications, and to stop the fast in case of symptoms of hypoglycemia, dehydration, or acute illness appears. Patients should monitor their plasma glucose on a regular basis throughout the fasting month. Patients should know that blood glucose testing during Ramadan does not break the fast. So you can test your blood sugar even during the fasting also. Now, what type of diet should be preferred by diabetic patients? You should take more vegetables, fish, fruits, meat, olives, full grains, roti or bread, and brown rice and nuts. Sweets should be avoided or it should be in a very small quantity. Proteins should be taken. Protein-rich food should be taken like milk, egg. Then carbohydrate like white rice, they cause hyperglycemia, so it should be avoided. And lots of fluids should be taken. It is a sunnah that Prof used to break the fast with the dates and water. So whatever you have on your dastakhan at the time of breakfast, we're breaking the fast, you should start your iftar with the dates and water. So it is recommended that to break the fast on dates as Rasulullah used to do, and dates have a low glycemic index provided it is consumed in a small amount. So 1 or 3. So odd number of dates should be taken, either 1 or 3. A date should be taken for breaking the fast, and should take the water, and after that whatever is available in your iftar you should take it. So due to fear of hypoglycemia, many diabetic patients, they refrain from physical activity during Ramadan fasting. But it is not like that. But physical activity should be encouraged in patients with type 2 diabetes during Ramadan fasting. So the Tarawih prayer is the best exercise during Ramadan after iftar meal, which involves repeated cycles of rising, kneeling, and bowing, should be considered as a part of daily exercise. So Tarawih should not be avoided. It should be performed. It is the best form of exercise after iftar. However, excessive physical activity, especially before the sunset meal or before the iftar, may lead to a higher risk of hypoglycemia, and it should be avoided. In case of type 1 diabetes mellitus, in children and adolescents with type 1 diabetes mellitus on insulin, there is more risk of hypoglycemia during fasting with HbA1c more than 8.5%. So children with type 1 diabetes should avoid fasting, and it is not compulsory for children also to keep the fast, but for the training purpose, we ask the children to keep the fast. Coming to the gestational diabetes mellitus or the diabetes during pregnancy. So in pregnant diabetic women on insulin, serum HbA1c levels are reduced after Ramadan. Thus, there is improvement in glycemic control during fasting period. So pregnant women with diabetes or gestational diabetes mellitus should avoid fasting in view of possible negative maternal fetal outcomes, like particularly the low birth weight babies because of the fasting. It is said that. So I say that you can avoid fasting during first trimester, but in second and third trimester, I think there is no need to worry because the child is more developed and the nutrition will reach the child. You should try to take high energy food after iftar, but you can do the fasting. Here, fasting calls upon us to know ourselves, to master ourselves, and to discipline ourselves the better to free ourselves. To fast is to identify our dependencies and free ourselves from them. Ramadan is not only about fasting, it's about patience, sympathy, humanity, love, forgiveness, kindness, and remembrance of Allah. So with this, I finished this video of effects of Ramadan fasting on diabetes and blood glucose levels. I hope that this video is going to be very useful for you people to decide whether to go for fasting or not to go for fasting. I request you and I say that please keep fast because the fasting has effects on our whole body, all organs, and each and every part of our body is benefited by the Ramadan fasting. So please keep all fast and maintain your blood glucose level and also take your diabetic medications on time. Thank you.